really that people have been very seriously affected. Many of our families in the county have suffered loss and bereavement, and this meeting is very much dedicated to them, and to actually respond properly and effectively as we go forward in terms of looking at the impact of COVID going and on our communities. So a warm welcome to everyone. I'm just going to ask if we can, just a few kind of housekeeping issues. Everybody will be on mute unless they're speaking, and they'll unmute themselves. If you would like to ask a question, please put that on the chat. Our colleagues, our team at the behind the scenes are monitoring all the questions, and we'll pick up questions at the end for all our kind of specialist health colleagues who will answer those. So please feel assured that your questions will be picked up. If we can't get to all of the questions today, we will try and get a note out after this meeting to everyone. So yes, please use the chat box as you would like. So the agenda today is to look at the kind of COVID vaccine information and its safety. There are lots of concerns in the Black communities around the vaccine, and I hope that today you will feel completely reassured about the need for the vaccine across all communities, and also some of the things you might have heard adversely to it. The doctors will cover those as well. We have a really important story from somebody who's actually survived COVID, and I hope that people will get a lot of information from that. We'll talk about long COVID, a condition that people are surviving as a result of having had COVID, and the support around that. And also some videos from kind of local community members, who've had the vaccine, and something about mental health, which is a really important issue given the levels of isolation and loneliness people have suffered as a result of lockdown. And then we'll take questions and answers. So if I can go straight to Dr. Itai Mutembike and Dr. Kamnath, who will cover a joint presentation on the vaccine trials and busting some of the vaccine myths. Oh, I'm sorry, I should have said we've got a quick poll to do, a short poll just to gauge where everybody is on the vaccine. It'll come up now. If you could just use your mouse to answer these questions, please. We can just take a poll at the beginning and then at the end as well. So just to give you a few minutes to do that. You can scroll down on the right-hand side to answer the third question. Just give you a few more minutes for that. Hopefully everybody's finding that easy enough to complete. We've just had half of the people complete. Just give you a few more minutes. Okay, so if you can see, the result is, that's a really high result. 77 people already offered the vaccine, and quite a high proportion in today's event are saying that they're very likely to have the vaccine. That's really good news. So thank you for that. And the last one, Nikki, I can't see the last result.
Seems to be.
Oh, I can see. Yeah, I can see it. Yes. So there's some worry that split between people have worries, some people not worried, and some people have family and friends who are worried. So that's really useful, and we'll do this at the end of the session as well. So if I can welcome Dr. Mutambike and Dr. Kamna, who are both from medical directors from St. Andrews and from Northamptonshire Health Community Foundation.
Thank you very much, Pratima. Good evening, everyone. And thank you very much for joining us this evening. I've got a few slides that I'm going to go through. And before I start, I just want to declare that the opinions that I'll express and the opinions that, Sanjit, when he speaks, will express are his own, as are mine. We're not being paid to do this. We don't represent any pharmaceutical companies, and we are clinicians. So I think Pratima has already given the local picture in terms of where we stand with the impact of COVID in our local population. But when I started looking at these figures and just monitoring them, for presentations such as this, we were, below 100,000 deaths in the United Kingdom, and we've, well above that now, with about 124,000 people dead as of today, 2.5 million people dead in the globally. Our vaccination program continues to happen at pace within the United Kingdom. I'm quite pleased that this number that I've got down there, which is 20 million, is actually now 21 million when I checked this afternoon. So lots of people, coming forward and being vaccinated. So far, about 33%, of the entire population in the United Kingdom has been vaccinated. And, we're looking at about 90% as a target for us to be able to achieve that herd immunity that will enable us to eradicate this devastating condition. It's important to note that these numbers are not just numbers anymore. These are names that we recognize. These are our close friends. These are close family, as Pratima was saying, and it's going to take a united effort for us to get through this. My own personal reflection, just before I carry on talking about the benefits of having the vaccine, is to really just say that I've had the vaccine myself. And the reason why I did it was, first and foremost, selfish. I wanted to protect myself, my family, my close friends, and then I wanted to protect the local community, that I find myself in. It was an easy choice to make. I had the privilege of being able to access some of the research evidence and make that informed choice about the safety and effectiveness of the vaccine, and that's one of the reasons why I was able to do that as quickly as I did. I do recognize that there is a lot of mistrust out there, particularly in the BAME community. The pharmaceutical companies haven't shrouded themselves in glory. There have been, experiments such as the Tuskegee trials in United States between the 1930s and 1970s, where, people of color were experimented on, and that has fueled, some of the mistrust that we see today. The other theme which is emerging now is, people, starting to feel really tired, feeling as though they're being pressured or blamed for being hesitant for taking the vaccine. I think it's important for us, and very much the theme of today is about, listening to concerns that people have, and giving people the right information to allow them, to make an informed choice about what they want to do with their health. Just before I carry on, I just wanted to point out, a number of colleagues, a number of senior clinicians who are part of the network in the region. One of these is Dr. Ananta Dave. She's, a medical director in Lincolnshire, and she, these are the reasons that she gave for having the vaccine. At this point, I'd like to bring in my friend and colleague Sanjit to just give a very brief overview of why he, has taken the vaccine in his capacity as medical director of St Andrews Healthcare in Northamptonshire. Sanjit?
Thanks. Yeah, thank you, Itai. So I took the vaccine as soon as the opportunity was available for me to do so, and that's in Andrews. I'm the SRO, that's the sort of senior responsible officer for the vaccination program. So I've been immersed in all things related to the vaccine in my organization for a number of months now. I've seen firsthand the effect that the coronavirus can have on people. I've seen patients die. I've seen staff members go off sick. I've seen the terrible effects it's had.
Join the meeting.
I've seen, I've had, sadly, members of my own extended family back home who've died from COVID. These are people who are roughly my age who've contracted COVID and died. So I honestly believe that the only way we are truly going to be able to combat this terrible disease is through an effective vaccination program, which leads to a degree of immunity in individuals and in the community. Most of what we're doing in terms of protecting ourselves, isolation, lockdown, they're all risk mitigating factors, but nothing is going to give us immunity like the vaccine will. I've seen fit and healthy people at work who've caught COVID and become really seriously unwell. And it's strengthened my resolve that the vaccine is something that is really beneficial and helpful. So what we've done is we've tried to encourage people to take the vaccine, but also to try and look at the research, look at the evidence, try not to be fooled by stuff that goes around in social media, and try to look at what the actual evidence is behind the vaccination and the effectiveness of it, and more importantly, the safety of the vaccine. I showed you some figures just now. I think it was 20 million people, 21 million people vaccinated. No one's died from the vaccine. 124,000 people that we know of have died from the COVID illness. So it's a really serious choice that we have to take and make the right one of taking the vaccine. So that's why I've taken it, and that's why I'm such an advocate for the vaccination program in my own organization.
Thank you very much, Sanjit. Just to point out, a couple of colleagues, from across the country, Edwin Lovo, who's a coup at East London Foundation Trust, and he's had the vaccine, and these are the reasons that he's given. Some of you who are on the call will recognize this face behind the mask, and that's Linia, who's a very good friend and colleague at NHFT, who's herself has had the vaccine. A number of other colleagues from different parts, of the NHS. This is Fungai, who's from, Barnet. Carolyn, who's also from Barnet. All of these are people of color, people who we work closely with, who've had the vaccine. So before we actually get into, why are we even, having a vaccine, I think it's just important for us to kind of have a little bit of a recap. I know most people know what COVID is, but just to have a recap on what COVID is, talk a little bit about the new variants, and then talk about, the vaccines which are out there, and, what vaccines actually are. Can I just check that you can hear me properly? Good.
Yes, we can.
Okay. So COVID is a severe respiratory illness which is caused by a virus, which is called SARS-CoV-2. Obviously, there are new variants now. It infects us by using a surface protein called the spike protein, and I'm mentioning the spike protein because that tends to be the target of vaccine development. The spike protein is on the surface. The reason why it's called coronavirus is that when you look at it under the microscope, it's a spherical virus which has got lots of spikes on it, and that's that spike protein which it uses to attach to our body's human cells and infect us basically. We know that there are a number of mutations which are out there, and a lot of people will be worried about, will the vaccine be effective against, some of these, new variants of COVID-19. It's important to point out that, despite there being, a Kent variant, a South African variant, a Brazilian variant, vaccine effectiveness may be slightly reduced, but not completely eradicated by the mutations. The mutations are on this spike protein, but that doesn't mean that the spike protein has completely changed its shape, that, the antibodies that we develop from having the vaccine will not be effective. So it's important for us still to continue to, push on with the vaccination program and protect ourselves from, this deadly virus. So vaccines themselves are not new, and a vaccine is a type of medicine that trains the body, trains the body's immune system so that it can fight a disease that it's not come across or come into contact with before. And vaccines, are designed to prevent disease and not to treat disease. So it's really important that we keep that distinction. So if you're already, infected with COVID, and you've just been infected with COVID, having the vaccine is not necessarily going to take that COVID away. What is important is for us to, all get vaccinated and have antibodies to the infection, so that when we do encounter it, we're likely to launch a much more robust immune response. So as I said, vaccines are not new. We've been using vaccines since the 18th century, when Edward Jenner started, developing a vaccine against smallpox. They come in many different types. They can be live weakened vaccines. They can be inactive vaccines. They can be toxins, which are, small components of the actual infective agent. And they can be new technology, such as, the COVID vaccines, the Oxford one, and the Pfizer and Moderna one, which I'm going to talk about in just a little bit. So the vaccines which are actually available or which are approved by the MHRA, which is the Medicines and Healthcare Products Regulatory Authority in the United Kingdom, are the Pfizer vaccine, which is what's called an mRNA vaccine, the Oxford vaccine, which is what's called an Adenovirus Vector, and the Moderna vaccine, which is another mRNA vaccine. I'm just going to show you this flow diagram and to just kind of explain how these vaccines actually work in terms of developing, that immunity that we need. So you've got the two types of vaccine. Remember, I said there are three vaccines which are approved by the MHRA, which are the Oxford, Pfizer, and Moderna vaccines. The Oxford vaccine, if you can see my cursor dancing around, is what's called an adenovirus vector. And basically this is genetic code, which comes in the form of an artificial, genetically engineered virus. It only contains the genetic code or the genetic blueprint to make the spike protein. So what it does, it enters the body, it produces this a spike protein as a single cycle. It does not integrate with your DNA. It does not reproduce within your body, and it does not cause any disease. So it produces this harmless spike protein. Remember I said, it's called the coronavirus because of all these spikes, on the surface of the virus structure. And these spike protein, the body starts to see these and starts to think, oh, there might be a virus on the loose within us. So we need to start to, launch an immune response and build up some antibodies to fight this infection. So after you've done that, you then have, antibodies within yourself to be able to fight the virus if you do encounter it. The other type of vaccine which is available which is approved by the MHRA is the mRNA vaccine. And the mRNA vaccine, again, this is genetic code. mRNA stands for messenger RNA. which is, the precursor for making proteins. So it's genetic code that the body uses to make proteins. And this is actually genetically engineered, genetic code, which your body then uses to make the spike protein through your muscle cells. And when you've made the spike protein, the body then recognizes that as something which is foreign and then launches an immune response to that agent. So the effect of actually receiving a vaccine becomes you having those antibodies to fight the infection should you encounter it in the future. So a lot of people will be very concerned about the fact that the pandemic hit 2019, and by the end of 2020 we already had a vaccine. And people would be understandably skeptical about the speed with which we've come to this point. So it's important to note that usually when the time that it takes to develop a new medicinal product is based on the length of what are called the phase 3 clinical trials. And usually with phase 3 clinical trials, the challenge is actually recruiting people who are willing to take part in those clinical trials. And that's why it takes a considerably long time to be able to do that. When this pandemic hit, and we had so many people dying of COVID, there was a global international effort to try and curb the spread of it. So governments put in quite a lot of money into the research and development of these vaccines. A lot of money was paid up front to pharmaceutical companies who had these candidate vaccines. And what happened was that the phases of the clinical trials, instead of being done in sequence, were done at the same time. So the phase 1 and phase 2, phase 3, they were all done at the same time. The regulators were able to see the data as it was coming out, analyze it, ask questions, and make decisions about progress for for the next phase of the trials. The other thing is that thousands and thousands of people volunteered to take part in these trials, and that is, that's the clincher. So just to give you, a comparison, to develop the hepatitis B vaccine, the total number of people who took part in what's called the phase 3 clinical trials was about 1,000. But just to develop the Pfizer vaccine, 43,000 people took part in that trial. For the Oxford vaccine, 23,000 people took part in that trial. For the Mrna vaccine, 30,000 people took part in those trials. And because of the number of people, we were able to sort of get, from the trial evidence, a really good, statistical analysis of the data that was coming in to be able to make a decision about, are these vaccines effective? Are they actually safe? And it's that, reassurance that I got, before I actually made the decision to have the vaccine myself. So as you can see from the trials, from the clinical trials, the Pfizer vaccine had a 95% efficacy. So which means for every 100 people that take the Pfizer vaccine from the trials, 95 of those people will be protected and will develop immunity to the virus. Yes, there will be 5 people who may develop, COVID. But what was found within the phase 3 clinical trials was that the vaccines, all the vaccines, were able to prevent serious disease in all the people who actually took part in the trials. So that's the trial. So you'll ask the question, well, this is an experimental, part of, the whole journey. What has actually happened since, these vaccines have been licensed? And there's a very encouraging paper that was published on the 22nd of February, which looked at the entire population of Scotland, and actually found that these vaccines are actually very effective at preventing hospitalization from COVID. So the one thing that they looked at, in these 5.4 million people was of the people who actually took this vaccine, whether it was the Pfizer or whether it was the Oxford vaccine, how many of those people who had taken the vaccine were actually prevented from being hospitalized with COVID? And it's actually looking like the Oxford vaccine, is really effective, 94%, as is the Pfizer, with an 85% reduction in hospitalization from COVID infection. It's important now for us to think about why we are doing this. The whole reason why we are asking people to have a vaccine is to stop people from dying from COVID. And if we've got something that actually helps us to stop hospitalization, stop the deaths which are associated with COVID, I think we're going in the right direction. But what's needed is for us to do this together. So I've got that slide there. I'm not expecting you to read any of that. And, I've only put that there just to make the point that any medicinal product which is approved by the MHRA for use, in the British population, has to have something called a patient information leaflet, which will, give details of what's what's actually in the medicinal product, what is the side effect profile, what's the effectiveness of that medicinal product. And this is what's in the Pfizer vaccine. By the way, this information is freely available on the www.gov.uk website, and you can look for yourself and see what is the side effect profile of all these vaccines, and also who has, having taken the vaccine, how many people, what proportion of people have suffered adverse effects. So all of that information is available, and it's published on the MHRA website. It's important, when people sort of start worrying about who's been developing these vaccines. Is this a plot to exterminate people of color, which is some of the kind of social media hype that you get on the internet. And it's important to realize that actually, a lot of the scientists who were involved in developing these vaccines, were actually of color. Dr. Tatenda Chopera is, of Zimbabwean descent, and he was involved in the development of the Pfizer vaccine. The Oxford vaccine, again, like I said before, when I showed you that flow chart, it's an adenovirus vector, and this is what is in it. Nothing like microchips or anything like that people who have been fear-mongering have been talking about. Again, I'm just showing you what's inside, the ingredients of the vaccine. The object here is not to try and confuse you with a lot of text. It's just to show you that everything that's there is published, and you can find out for yourself. And if you do have allergies, particularly to some of the ingredients, so this PEG protein, where you can see my my cursor dancing around, is the one that has been associated with those severe what are called anaphylactic reactions. And anaphylactic reactions are severe allergic reactions that you can get from coming into contact with something that you're allergic to. Your face starts to swell up, your airways start to get blocked, and you find it very difficult to breathe, and you need emergency care when you are undergoing such an allergic reaction. Can I just check that people can hear me and I'm not breaking up or anything like that? Okay, that's fine. My internet connection sometimes is a little bit dodgy, and I just want to check that I'm doing okay.
It's very clear, Doctor.
All right, brilliant. Again, some of that technology of of the mRNA technology developed by people of color, Kizzy Corbett, very young scientist, African American, who kind of developed the mRNA technology, which is behind the Mrna vaccine as well as the Pfizer vaccine. What's not in the vaccine? Like I said, I've taken this vaccine myself, and there's no mark of the beast. There's no microchips in it. There's no mechanism in there to change your DNA. There's no poison designed to exterminate Black people. it's, I took my, first dose of the Pfizer vaccine in December, and, I'm still here, and, I'm, fit as a fiddle and really healthy. And I can understand, the concerns that people have, about large pharmaceutical companies. And like I said, right at the beginning of my presentation, Sanjit and I are not, representatives of drug companies. We're clinicians, we're BAME clinicians. Both of us, are just as upset as the next person about, the consent issues involved in the, meningitis trials conducted by Pfizer in 1996. We're just as, appalled at, the way the Tuskegee trials were conducted. We're also just as dismayed as most people of color, about the health inequalities that exist. And this is one of the things that, brings me here today. It's about tackling those health inequalities, asking people, to take a medicinal product which is going to protect them from a deadly virus is part of tackling those health inequalities. The research evidence was robust for the COVID vaccines. I looked at it myself, I saw the papers, and I wouldn't be standing here today trying to persuade people, to have the vaccine if I didn't believe in what I'd seen. I don't want to die from COVID. I've got a lot of life to live, and that's the reason why I've taken it. So it's not about, what's the history of the, pharmaceutical companies, what's, what has happened to people of color in the past. I don't want to see more BAME people who are, at fourfold risk, of dying from COVID, to carry on dying. I don't want to see that. As a Black man, I don't want to see that. And that's why I'm encouraging people who are most at risk to take the vaccine. And I think you can take a stance. But what I would ask you, what I would appeal to, to anyone who's listening today is, do not cut your nose to spite your face. This is about your health. This is about your protection. Make the decision, make the informed decision that helps you to move forward. People are worried about the long-term effects or the long-term side effects. Whenever I'm faced with this question, I often say, one of the most horrible side effects of anything is death. The final, effect of, COVID has been the death of, 2.5 million people worldwide. Sorry, there's someone who is talking. If you can mute. Okay, thank you very much. And, I think most of us who are here present will know of someone who has died of COVID. I think it's important for us to think about that. What we want to do is to survive as a human race. And what we want to do is to find a means of survival. And if we've got something that the evidence shows us, has been effective at, stopping, hospitalization from this deadly virus, let's take that option. If, for instance, we wanted to wait 10 years to see, because that's the only way you can, with certainty declare that there are no long-term effects of a medicinal product. If we were to wait for 10 years to observe those 43,000 people who had taken the, Pfizer vaccine, that would be, after 10 years, at the death rate that we've seen, at enormous human cost. Something has got to give. We have to make a decision. The way these vaccines are designed is such that they are not likely to, to have any impact, on your long-term health. So there have been concerns, obviously, about, why has the, when initially the regimes for, vaccination published by, the pharmaceutical companies was 3 weeks between the first and the second dose. Why did the government take the, the decision to extend the time? And this really was about, trying to make sure that we got the vaccine, at least the first dose of the vaccine, to as many people as possible. And that, for me is is very important. The more people are vaccinated, the easier it's going to be to sort of curb the spread of this deadly virus. What we've seen is that between day 28 and 34, you're still getting that, 85% protection from hospitalization after a single dose of the Pfizer vaccine, 94%, after a single dose of the Oxford vaccine. This is what, the post-licensure, observational studies are telling us. And that's pretty compelling evidence that, it's not to say that, we're not going to give people the second dose. And, so far with, 21 million people having received the first dose, and, over 1 million people now receiving the second dose, and, the second dose program well underway, locally in Northamptonshire, people will receive the second dose. But actually, the timings, are less, important than the fact that we are trying to reach out to as many people to get the first dose as possible. I don't say this to be an apologist of the government, but I say this because I think, the evidence is quite compelling. People are concerned about fertility, and why wouldn't you? If you're a woman of childbearing age, why wouldn't you be worrying about, whether, you'll be able to have children if you took a medicinal product? So here's what we know. There is no evidence to support, these social media, assertions that, it may cause infertility. What we actually know from the phase 3 clinical trials, particularly the Pfizer one, is that 23 women did actually become pregnant, after taking the first dose of, the Pfizer vaccine. The Royal College of Obstetrics and Gynecologists have released a statement through through their president, Dr. Edward Morris, basically giving reassurance to women that there is no evidence that the vaccines will affect fertility. There's no biologically plausible mechanism. You remember I showed you how the vaccines actually work, and there is no mechanism given that that you would not be able to conceive after receiving the vaccine. And the information sheet, that will allow women of childbearing age, breastfeeding mothers, to make an informed choice, is actually available on the Royal College website. And again, this is free access. So if you log on to that website, you can just see for yourself what the advice is and make a decision that will help you and your unborn child. It's important again, and obviously Sanjay, when he speaks, will shed more light on this. That whenever you're unsure about whether or not to take any medicinal product, your GP is the first port of call. It's your GP who knows your medical history, who knows all the contraindications, etc. That's the person that you need to have a conversation with if you're worried, about your long-term conditions. Again, if you are in what's called a clinically extremely vulnerable group, actually, the Green Book, which is the Bible for doctors for deciding who gets vaccinated when and how, actually advises that people should be prioritized if they are in those clinically extremely vulnerable groups. So if you've got an impaired immune system due to HIV or cancer or or other long-term conditions, the advice is actually that you get the vaccine and that you're monitored very closely. Again, some people, there's all sorts of stories flying around. There was once this, scare that, the Oxford vaccine is not effective in, people who are over 60. And again, this was based on, the trial, the fact that only 2 people in the clinical trials, just to be clear, in the clinical trials, got COVID And it was therefore very difficult for them to sort of say, actually, whether the effectiveness was there in people who are over 60. But that's, that should be reassuring, so it's more likely than not, that you are protected from the Oxford a vaccine if you're over 65. So that's in the trial. What we've actually seen is that 20 million people in the United Kingdom have now been vaccinated. 21 million people. My slide is 1 day old, and already this has changed. 21 million people have now received the vaccine. 97% of people over 90, over 80 years have actually received the vaccine, and that's both the Oxford and the Pfizer vaccine. And again, all of those people, we're seeing, that reduction in their hospitalization. This is a vulnerable group of people, and we're seeing that the vaccine is quite effective at protecting them from hospitalization. I'd like to thank you very much for listening. And I might have gone over a little bit, Pratim, on the time that you allocated me, but I just thought I would try and make it as easy as possible for people to understand. There's a lot of information to take in, and hopefully if people have got some burning questions, we might address those in the Q&A session. Thank you very much.
Dr. Mutembike and Dr. Many thanks. We have had lots of questions and you covered some of those, but we'll cover them later. And thank you for your commitment as a Black professional, because I think that kind of came across really importantly. And the fact that, yes, we know there are health inequalities, but this is important that we can comply with the guidance and take the vaccination. So many thanks for that. We'll go on to now a really important video by Amelia Chitenge, who's giving a personal story. Amelia is a Black nurse working locally, and you'll see from her story how she's survived COVID, and congratulations for that. She's with us today as well, which is great, but please let's watch her experience of surviving COVID.
Hi everybody, my name is Amelia Chitenge. I want to share with you my story of how I got COVID-19 last year and survived, and also how I came about to end up having my COVID-19 vaccination 2 weeks ago. So last year, April, I visited 2 patients just before my annual leave, where I feel I may have been exposed. So the first patient, there was no indication that they had COVID, and I'd gone out to assess this patient, and whilst I was checking her blood pressure, she coughed several times in my face. I had PPE on, but nevertheless the contact was quite close. But I felt I was adequately protected because I had my PPE on, so I didn't think much of it at the time. The following day I visited another patient, of which I spoke to the family prior to actually going into the property, and they confirmed to me that there was nobody unwell, no one had symptoms of COVID. So I went in to do my assessment, as I would normally do, and the daughter of the patient, whilst I was taking my PPE off and I'd actually finished the assessment and about to leave the property, she came quite close to me and she sneezed. I was not amused at all, to be honest, at the time, as you can obviously imagine. But I didn't think much of it because she had confirmed that none of them were unwell, and they were all fit and healthy. And so I thought nothing about it at the time, and I left and I went home. That was my last patient that I was seeing for that day, actually. And so I went home to my children. And later on in that evening, the GP called to give me feedback and the plan for this patient. So obviously I had to ring the daughter and inform her about the outcome of what the GP had said. And whilst I was informing her this, she sort of stopped me and said, well, I feel a bit bad for us having to keep going into Mum's house because my husband's not very well. And I said, what do you mean? And she said to me, well, he's been coughing, and today he's got a temperature, and also he's quite short of breath. I don't know what to do. Immediately I knew my heart just sunk, and I thought, goodness me, this is now the second person. I didn't want to think about it too much at the time, but I thought I'd better take precautions just in case. So I spoke to my children and I explained to them that, you know, you can't hug mummy, you can't kiss mummy for the next couple of days. You can't come very close to me, and you can't come into my bedroom. Very difficult to explain to young children because they were, at the time, they didn't quite understand as well, just like a lot of people, how this virus worked. And so I isolated myself pretty much for the next couple of days. And when it happened, I knew aches and pains everywhere. I had a fever, 38.9. The pains in my chest were excruciating. The cough. At one point, I called the ambulance about 2 o'clock in the morning because I didn't want my children to see the ambulance or hear anything that was going on. I waited till 2 o'clock in the morning when I knew that they'd been in deep sleep. I didn't want them to worry about me. I didn't want them to be anxious that anything was happening to their mum. Being a single parent, I knew that if I had to go to hospital, my kids would have no one to stay with them, really, because no one would be able to come into the house because they've been in the house with me. And so I made a decision, and I chose to stay at home with my children. I didn't want to go into hospital because I was worried about my children. And so I stayed at home. The fever eventually broke, and my journey to recovery started. It was long. It was a long journey to recovery. From not being able to barely walk to the bed, to the toilet, you know, to being able to start doing household chores and, you know, bit by bit. Eventually I had to go back to work. My children were frightened. I had to work. The financial implications that COVID had had on me, being a single parent, I used to work quite a lot of extra shifts to supplement my income. But because I'd stopped working for a while, yes, I was on sick pay, but there's the extra shifts I used to work to supplement my income that wasn't coming in. And that made things very difficult for me. And I remember in May, the month of May, I had to cancel quite a few direct debits because I couldn't meet my bills that month. And I had to explain to quite a few companies that I'd need to look at what I can do to pay them back. And so COVID had real financial implications for me. I'm grateful because my trust managed to look into it and something was done about it. But going back to work was very difficult. I still had the aches and pains. I still had difficulties with breathing. I was still getting short of breath. And having asthma, the asthma worsened and I ended up having to go on a different inhaler. They had to upgrade me to a stronger steroid inhaler. I had lots of other problems after I had COVID. I had gastric ulcers. I couldn't eat the food that I normally ate. Constantly having headaches. I had bleeding as well. My periods were a lot heavier than normal, which ended up leaving me anemic. and I had to go on supplements and all sorts of other things. So my recovery was long. It was long, but I want to say that I wouldn't have managed if it wasn't for the support that I had around me. I'm so grateful for my church family who brought meals for me and the children whilst I was unwell. My sister who brought medications in through the door. My colleagues, the BAME network from NHFT that were constantly texting and checking on me. My line manager, very supportive all the way. I'm so grateful. And I think that was one of the things that helped me throughout my journey. And then when I heard that there's a vaccine out, I was not the first person to put my hands up, because I sort of thought to myself, well, that's interesting. How come they've managed to create a vaccine so quickly? And I was a bit reluctant, to be honest, to take up the vaccine without knowing a bit more information about how they've come about it and what exactly the vaccine comprises of. I was worried as well because I'm quite sensitive to a few things. I've got allergies, and I think that was my biggest fear, that, okay, what if, I have a reaction? So there was lots of things to think about. But I think the biggest thing that moved me to end up having my vaccine was the death of my uncle. My uncle died 4 weeks ago. He was my mum's youngest brother. He was my friend. He looked after me when I first came into this country 21 years ago. Such a wonderful man, very knowledgeable. Doctor in chemical engineering at a university in London. He was always there for me. My whole career, to be honest, I owe to him. I wouldn't have made it if it wasn't for him pushing me, cheering me on. He went to Zimbabwe soon after Christmas, after we had lost another close family member. And unfortunately, he contracted COVID while he was over there. Ended up on a ventilator, and he didn't make it. My world shattered to 1,000 pieces. He was my world. He had no underlying conditions. He was healthy. And yet he died. COVID robbed me of my uncle. And so, during that process of grieving and thinking what was the best option for me, I thought again about my situation, my circumstances. I've got children, 3 children that depend on me. And I thought to myself, I need to protect myself. 2 of my children are asthmatics as well. And I said, if I get COVID again, I could pass it on to my children. Or if I get it and this time I don't make it, then what happens to my children? That was one of the driving forces for me. I want to encourage you, or anyone that's hesitating, to take up the vaccine. I came up with all sorts of excuses, and I'll be honest with you, the stuff I watched on social media didn't help at all. There's lots of propaganda, lots of stuff out there. But to be honest with you, I would say go out and get information and read and understand for yourself what it is, what's in it. I went out and I did that. I had help from other colleagues as well that got me information. And I felt really encouraged as well by watching other colleagues that had had theirs and they were absolutely fine. And I said to myself, you know what? I'm going to go and get mine. I spoke to my GP as well, and I made a decision, and I thought, you know what? Let me go and have my vaccine. I said, in any case, the worst case scenario, they know I've got allergies, and I know that they'll make sure that they they look out for me after I've had the vaccine, and of which they did. It was a fantastic experience. I explained to them that I had allergies and that I'd had an slightly anaphylactic reaction to an injection before in my childhood. And so they made sure that they had the right member of staff, they had the right equipment nearby in case anything happened. And I got my shot. And here I am, I'm absolutely fine. My arm was a bit painful for a couple of days. And initially when I had the vaccine, I felt a bit queasy. But that's because my body's really sensitive. And that was about it, really. And I'm fine now. And I can't wait to have my second one. So I want to encourage you all, those that are hesitating, vaccinate. Don't hesitate. Do it to protect yourself. Do it to protect your loved ones. Do it to protect people around you. You'd rather do it now than regret. I wish my uncle had had his vaccine before he'd gone. Maybe things would have been different for him. Maybe he'd still be here. I don't know. But I want to encourage you all. Don't hesitate. Thank you for listening to my story, and hopefully this will inspire and encourage somebody. Thank you.
Amelia, that was an incredible personal journey that you've just discussed. I can feel the audience was absolutely gripped, and some really good supportive messages for you. Like I say, Amelia is with us, and many thanks for giving us that kind of very personal kind of story and the struggles, really. So thank you. We'll take questions for Amelia at the end as well with all the doctors. Thank you.
Thank you for listening. Thank you.
Okay, thanks. Okay, let's move on to condition called long COVID. Some of us may have heard about this, but this is another important area that we need to be all aware of. So Rudo Chimera, who's a clinical specialist, and Penny Edwards, who's won't necessarily be speaking, but is with us as well, who's a long COVID coordinator, and they'll talk about long COVID. Thanks, Rudo.
Thanks, Fatima. My name is Rudo Chimera, and I'm a clinical specialist respiratory physio with the intensive care unit at Kettering General Hospital, but I'm also the therapy team lead for the cardiorespiratory team. So the acute respiratory wards, the community respiratory team, and ICU as well. So I was asked to speak about long COVID, but I've only got 5 minutes, so there's not going to be a slide or anything. So I'm basically just going to talk about what long COVID is in brief, and then just mention a little bit about the post-COVID recovery task group that I'm a part of. So when COVID began last year in 2020, most people were just focused on the acute side of COVID. So the symptoms, the ventilators, the PPE, and things that were associated with COVID during that time. But nobody had foreseen what was going to happen down the line. So the National Institute of Clinical Health and Excellence came up with a guideline, really, because as people were progressing post the COVID symptoms, they were coming up with all sorts of problems and complications that were happening. So they come up with a guideline which basically grouped COVID into 3 categories. So the first one was your acute COVID-19, which is where people would have the signs and symptoms post-infection infection that will last for up to 4 weeks. So most people, normally after 6 weeks, they tend to recover fully from the COVID. And then there were those that were ongoing symptoms, what they call the ongoing symptomatic COVID-19, that was lasting for 4 to 12 weeks. And then after the 12 weeks, the COVID, people would recover from that. But then it emerged a group of people that still had the signs and symptoms of COVID, sort of 12 weeks post the diagnosis of COVID. So they had to more or less like be categorized into what was called the post-COVID syndrome, or as it is called now, the long COVID syndrome. Long COVID that we are talking about. So as a result of that, in Northamptonshire, there was then what was called the post-COVID recovery task group that was formed about 8 months ago now, of which I'm part of that group. So basically it was set up, consists of the clinical commissioning groups, the NHFT, NGH, KGH, and all the other trusts that are in the county. And the whole reason why that was set up, it was to form a post-COVID recovery pathway for patients admitted to the hospitals and patients that were in the community that still have obviously the persistent symptoms of COVID. And then we did manage to come up with what we call the Northamptonshire long COVID pathway, which became active from the 14th of December. I think that's when the first patient were admitted or went through the Northamptonshire long COVID pathway. So the symptoms mainly of long COVID are things like breathlessness, which is persistent for so many people. And then for other people, it's things like fatigue. And then there are also those people that have got mild cognitive impairments. So things like what they call the brain fog. So basically as a task group, what we did, it was to come up with these pathways, and then where the patients will be assessed by the members of the MDT, and then they are signposted to the right service. So it could be things like if it's respiratory, there's the respiratory outreach team. We've also got Penny, who was supposed to be my co-presenter today, who's come up with a video that's going to go into the community pack that you're going to have at the end of this meeting. So in there's what came as a background of that is what's called the Kicking Back at COVID support group, which basically focus on things like your breathing techniques, how to manage things like your to clear phlegm, how to manage persistent cough. Also on the background of that, as the team lead, I'm part of the pulmonary rehab group, and we've taken on things like dysfunctional breathing and how to manage that, and also some techniques on how to manage things like fatigue. And then on the background of that, one of the problems as well that has been coming on as a result of the COVID is things like anxiety and depression. I think someone is going to talk about the mental health side of things and what's available in the county to help people with that. But for us as physios, we've got quite a lot that we can help with regarding your breathing, regarding things like pacing and managing your fatigue. So all that information is going to be in the community pack. And then the other thing also that we help with through our occupational therapy services is things like lifestyle management, how to get back to work, things like relationships with families and things like that. That's also covered as part of the long COVID group. So like I said, it would take a whole day for us to talk about exactly what long COVID is, and this, people are affected differently by it. But I just wanted to tell you about what we have as a county. And then for those maybe that still have the persistent symptoms 6 weeks post having the COVID diagnosis, there's also an online digital platform that's called your recovery program. So that can easily be accessed on all of the media platforms, but you just go to www.yourcovidrecovery.nhs.uk. So there's quite a wealth of information on there on what long COVID is. It covers a range of things from managing your breathlessness, your fatigue, how to get back to work, nutrition advice, lifestyle management advice. So it's all those things that we've been looking into as the post-recovery task group. So like I said, I've only got 5 minutes, but the pack that we've come up with, it has got all the information that you can access after this meeting. So I'll be open to questions at the end as well. Thank you for that.
Rudo, thank you so much for this. I know as a community and some of the responses we're making as community organizations is moving on to long COVID. So it would be great to have you and Penny come to some of the wider community events as well, because I think people are getting really concerned. And it's great to know, I know in a pre-briefing, Penny was saying about it's a really dedicated resource for long COVID. So I'm really, really pleased that we have that resource in the county and that one we can tap. So many thanks, and Rudo will be available for questions straight after this as well. Let's go on to kind of Dr. Gadia, who's going to talk about the vaccination program across Northamptonshire. Dr. Gadia, over to you.
Thank you. I think the slides are up there. So just to introduce myself, my name's Sanjay Gadia. I'm a GP in Corby in Northamptonshire, and I also work for Northants Clinical Commissioning Group. And over the last 12 months, I've been focused on the vaccination program to get it up and running. So just to give you a very broad oversight, the vaccination program is up and running, and I kindly went over all the vaccines, so I'm not going to cover that. But the main thing is that the vaccine will be offered to everyone. However, we can't give it to everyone in one go. So the experts and specialists have come together with a priority list, and the priority list is based on those who are most at risk, and it works down accordingly. And we know that there are multiple risk factors. So the main ones at the moment that currently we're giving the vaccine to are people aged 60 and over, people who are at high risk. So I refer to them as the clinically extremely vulnerable, and people will know these as people who are shielding. Then we have the other group, which are clinically vulnerable, and these are people who have other health conditions. We're also vaccinating people who live or work in care homes, because obviously because of the age there's a risk, and also health and social care workers. And also people who are getting carers allowance, are looking for people. So these are the current groups at the moment, but this is changing constantly. People who are not in the priority group list that are displayed at the moment, they will be contacted, but it will come in turn. So as we work through the different cohorts. Next slide, please. So in Northamptonshire, having spoken to colleagues and that elsewhere, we are so lucky. The vaccination program has been run at such a pace that we were one of the first places off the mark on the 8th of December, and we have kept this pace going throughout. So there are many places that you can get the vaccine from. I think one of the big things to point out is that before 8th of December, all the GP practices in Northamptonshire came together, and they decided to all work together to open up 16 GP-led sites across the county. And in addition to that, we opened a large vaccination centre, which is at Malton Park in Northampton. And this is the large vaccination centre. Because of this, the numbers that we have managed to vaccinate so far have been at such pace that we've been highlighted, and I know it was mentioned in the media a while ago that the numbers were surpassing what was happening elsewhere. But what it's meant is that people have an option. Now, many people who fit into certain groups, for example, based on age or by the fact that they've received a shielding letter, may have received a letter to book directly into the vaccination centre. And if that happens, you can certainly do that. You can book directly into the vaccination centre. However, if you prefer to be vaccinated by your GP-led service, then that's absolutely fine as well. You can contact your GP to say that you'd still like to receive it, and they will generally still be inviting you. So it's a choice wherever you'd like to go. The system that we all use to record the vaccines is the same. So you don't have to worry about, oh, well, if I go there, then I'll be stuck. But wherever you do go for your vaccine, the main thing to remember is that that's where you need to then go for your second vaccine. because we then track where we need to deliver the second doses. Just to give you an update, and like I said in his presentation, these figures have changed. These were the figures on Friday that we last saw. So in Northamptonshire so far, we've delivered 228,000 doses of the COVID vaccine. This is first doses, and you can see the various age groups on there. I won't go into all those, but you can see it's a phenomenal amount. All these places, your GP practices, the mass vaccination centre with the volunteers have been pulling together to make sure that we can get this done as fast as we can. So as soon as these vaccine deliveries are coming in, within days they are being used, which is the right thing. We want them to be given to people and not be sitting on shelves, and so that's what the main aim is. The next slide, please. So if you do want some more information on the vaccination program, there's a web address there which will be circulated, and you can obviously go onto that website, and it's available in different languages, and that will tell you information about the vaccine, information about the ordering of the vaccine, but also how the vaccination centre and the GP-led sites will work. Next slide, please. There you go. I'm not going to go over this. I know there's been a lot of stuff out there. I think the main thing I wanted to say, because as a GP, I get many calls about this, and it really worries me. To be honest, I've had family members who've had this. First of all, the vaccine is free. Please, if anyone is asking you to pay for a vaccine, this is fraud. It's a scam. The vaccine is free. We will never ever ask you for your bank details or for any other information besides your name and date of birth. And whenever we contact you, we'll be using those. So we will contact you, and you'll see that. If anyone's asking for any of those things you see listed there, it's a scam. Please, you'd think at a time when we're all in crisis, we wouldn't have to deal with this, but unfortunately, it's a big issue. And fortunately, we've had patients that have called us first when they've been called by this. It's happening everywhere. So please pass it on to family members and friends that the NHS will never ask you for any of this information. The vaccine is free. You can't pay to have the vaccine anywhere because it's a pandemic licensed drug. So it will always be free and provided in that order. Next slide, please. Thank you very much. Hopefully I've saved a bit of time there.
Thank you, Dr. Gadia. Again, just that information about the fact that the vaccine is free, we've heard no end of people thinking, that you might have to pay for it, or indeed there are scams going on. So many thanks for that. We'll go straight to the question of mental health. We said that mental health was always a big issue anyway across the country. And we know that through COVID, this has become an even bigger issue. So really pleased to have Dr. Sunil Lad, who is a clinical psychologist with the Foundation Trust, and he's going to cover this topic. Dr. Lad, over to you.
Thank you, Pratima. So welcome everyone. Just thank you for inviting me to talk today about our mental health, because I think it's a really important aspect which sometimes within the BAME community we don't always think about. So I think it's really important we use COVID as an opportunity to be really able to think about our mental health and well-being. Next slide, please. So I guess one of the things I really want to kind of recognize is that over the last year, our lives have drastically changed, and we're not able to do things which gave us previously lots of fulfillment, enjoyment, and joy and happiness. And as you've heard today, this pandemic has led to a lot of illness, a lot of death, and sadly a lot of bereavement as well. And we know with these type of events, they not only affect us psychologically, but that also has an impact on our nervous systems. And I think it's really important that we think about tending to our health, because sometimes we feel we've got to fight on, we've just got to keep going. And I think that's when our mental health tells us, actually, no, we need to stop. So we either shut down physically. That's why we have different emotions. And it's really important that we tend to those. So next slide, please. So emotions, they're there to help us as human beings. They help us to kind of respond to different situations and guide our behavior. They've got many different functions. You know, if we think about anxiety, it helps, you know, fear stops us from going into dangerous places. Anger helps us to fight things. And actually all of those different emotions are associated with different bodily reactions. And that's what helps us to survive as human beings. And they're the products of millions of years that we've actually not got any choice over. You know, none of us have got the choice not to feel angry, to feel sad. When situations happen, we do get affected, but it's about what we do with those emotions that are going to be really important. So next slide, please. So what we need to understand is that we've got three different groups of emotions that we could have. So the first one is what we would describe as a drive excitement system. So this set of emotions, it's what makes us feel excited. It's what makes us kind of go to work each day because we get a reward at the end. It makes us also, it's what's associated with getting food when we feel quite nice after a nice meal, and therefore we do more of it. So this part of our brain kind of makes us feel excited. It makes us feel good. And some of those things that we might have lost might mean that actually we're not having that system being activated at the moment. If you could just press the next button. So the next system is what we describe as our rest and digest system. It helps us to connect to other human beings. It's what helps us to feel safe and connected. But sadly, we're not having aspects of that at the moment. You know, we're not able to meet in big groups. We're not able to connect with each other. And again, this part of our system, which makes us feel good, which actually helps to restore our nervous system, isn't being activated through attachment relationships. And then our next bit. So then this last system is what we would describe as our threat system. This is what activates us when we're in any kind of danger. But the thing is, our brains are so different now because of how we live our lives. So, you know, if we compare ourselves to other animals, a zebra sees a lion and it successfully runs away, but actually half an hour afterwards, it'll just go to eating grass. If we saw a lion, what would we do? We'd be kind of thinking and worrying about it. And actually just thinking and worrying about it activates our nervous system. So that's why we have different levels of anxiety. That's why our well-being is affected, because what happens is that different thoughts go through our head, which trigger off our body. So next slide, please. So we've got to really think about what messages an experience we've had in relation to these different emotions. So if we've been taught, actually, you know, crying is wrong, or you don't do that in public, or you don't do that with this person, then actually you're going to shut off and you're going to stop. But actually inside, all these emotions are going around you. So it's really important that we think about how do we deal with emotions which are totally normal, like sadness, fear, and actually think about how to process them. Sometimes we might use things like food or different, you know, alcohol, prescription medication to just shut those things down, because actually we've been taught or told those things are bad. So it's really important that we think and learn how can we start to connect with these emotions. But I will also warn you, that they can feel extremely painful, but there's a reason for those things. And then also think about how do they feel in our body? How do they feel in our mind? How can we learn to safely sit with these different emotions? But also, safety is an extremely important thing. Don't just force yourself to do these things, because if you do, then these loops might go around in your brain, which kind of make it even worse. Next slide, please. So we've also got to remember, thinking back about that lion, there's a reason our threat system is well developed, and that's because it kind of links to our survival. But the thing is, different things will activate it. And the thing is, our brain runs on the principle, it's better to be safe than sorry. So sometimes when you get those messages on your phone, on WhatsApp, there'll be reasons that, yes, they trigger off this kind of, this threat system, this fear system in you, but we're more likely to believe some of those things because your brain is running on the principle, it's better to be safe than sorry. So next slide, please. So we've got to think, yes, we're not in the middle of a jungle anymore, that we're going to see a lion, but we've got current threats. You know, every time you get a message on your phone, kind of think how many messages on your phone have been negative information. When we watch the news, it is a lot of negative information. This activates our threat system. You know, the threat of COVID is real, we've seen it. But at the same time, sadly, our news organizations on the media, and also people who send things on WhatsApp and stuff, they're driven by, you know, kind of fear is quite contagious. You know, getting people angry is quite contagious. So we've got to really think about actually how can we tone down our nervous system, because our brain, it kind of sticks to information which is threatening and negative. You know, think about your day-to-day events. 10 nice things might have happened in your day, but you'll remember the one not so nice thing that's happened. This is the way that our brain works. So it's going to be really important that we kind of step back from our emotions, because what happens is that our thinking narrows when our threat system comes on. And that's when anxiety will also increase. Next slide, please. So it's really important to recognize that, you know, that threat, that negativity bias is really important for our survival. But this also means that, you know, it's got a negative side to it as well. It means we can easily jump to conclusions. We can focus on things that easily threaten us. This isn't our fault because our brain is designed this way. But as we've seen over the last year, it can be a huge problem. Next slide, please. So, you know, thinking about how, because going back to those earlier slides, our excitement system, eating, you know, in order to feel good, we might have lost social connection. So we might be eating comfort food, which has got lots of sugar in it, which also makes us feel good for a bit. But, you know, we also know that COVID puts you at risk. If there is obesity, we know within the BAME community, there are higher rates of diabetes as well. So all of those things will affect both our physical and our mental health negatively. So really kind of be aware of different foods, making sure that we can engage in different healthy exercises. Also, not being able to do things which make us feel good, which leads to higher rates of depression. You know, we're not getting touched by other people as well, which can also be extremely healing. We're not able to meet each other and feeling socially isolated. So all of those things are going to affect us even more. So our ability to deal with things is going to be hugely affected. Next slide, please. So what is helpful? So having just a caring and compassionate approach to others, and that can be extremely tough when others are doing things, but they might be working outside of their own threat system as well. Again, having a balanced diet and exercise, having things that give you a sense of accomplishment and achievement. You know, I feel really good today about cleaning my house. I just blitzed it out, and actually I feel good that I've achieved something today on that. Avoiding things that bombard, you know, I think sometimes I switch off my phone. I don't want to look at Twitter for too long. I've also kind of left groups where there's lots of negative scare stories as well on WhatsApp. So being aware of those things as well. And yeah, I've just quickly seen in a comment, yes, yoga and meditation can be extremely helpful as well, being a yoga teacher myself. Next slide, please. I'm going to pass over to Rowena, who's going to talk within Northamptonshire about one of the IAP services which are looking at supporting people with anxiety and depression.
Lovely. Thank you so much, Dr. Ladd. So yes, my name is Rowena and I work for the IAPT Changing Minds service as a senior psychological wellbeing practitioner. First of all, thank you so much for having me here today to be able to discuss IAPT and what we offer and how anybody can refer for support, including those from the BAME community. So our service is open to everybody over the age of 17.5 years old. And we support those who struggle with mild to moderate common mental health difficulties. And this can include your standard depression and all types of anxiety disorders. So you've got generalized anxiety disorder, PTSD, OCD, etc. At the moment, we are currently supporting those who are fearful or uncertain about returning to normal life post-COVID, those who are suffering from long COVID, and some whose existing conditions such as OCD or health anxiety has worsened due to the pandemic. And we also support anybody who's having difficulties completely unrelated to COVID-19 as well. So referrals will come into our service, either a self-referral or through a professional, including your GP, health visitor, those from secondary care. And you're then booked into a 45-minute telephone assessment with one of our team. And a variety of options regarding treatment are discussed. And then if suitable, we can offer you some support to help deal with the difficulties that you may be presenting with. This can be on a one-to-one basis. This can be within groups using computerized CBT and webinars. So all of our therapists follow cognitive behavioral therapy principles and ensure individuals have tools to help them move forward after therapy to essentially become their own therapist. So it's very much guided self-help. So yes, as discussed, you can self-refer by using the number on the screen or self-refer using the referral form, which is found on the website. And our leaflet containing more information about our service and what we offer will also be available within today's community pack. And just a final note to kind of say and to reassure people that, you know, there are services, including IAPT, who are there to support you with mental health difficulties. We hear a lot about the physical difficulties when people are experiencing COVID, and that's both directly and indirectly. But it's important not to neglect the mental health side of things as well. And to remember that everybody, whilst we're all going through this together, it's impacting people differently. So is it to say during these times, we're all in the same storm, but we're all in different boats, really. But yes, thank you. Any questions, I'm happy to answer when we get to the Q&A session later on. Thank you.
Dr. Ladd and Rowena, thank you so much. A really important area I think we've neglected in the COVID information and work so far. So I think that's the work we all need to do kind of going forward. So many thanks for that. We're going to go, we have had so many good comments about all the presentations. So my big thank you to all the presenters. I think we've had a huge amount of breadth of information, covered incredible number of different topics that are really relevant to local people at the moment. Let's go straight into the questions. We've had some preset questions, so I'm going to take those first, and you'll have seen a lot on the chat as well. So I'll ask different doctors and different presenters to kind of field some of them. So just to start off with, we've had a question on advice on social distancing within multi-generational households. If I can ask Dr. Sanjay Gadhia or Dr. Kamnath to respond to that, please. Dr. Kamnath, would you like to come in first?
Yeah, thank you so much. So it's a really good question about what do we do if you live in a multi-generational household? So one of the things that makes coronavirus or COVID so deadly is its high infectivity. So it's easily transmissible from one person to the other. And what we do know about BAME communities is many of us live in multi-generational households where you have very young children, adults, and older adults as well. So the key thing is to work out, are there people within your household who are at a much higher degree of risk? So being from a BAME community already puts you at some degree of risk, but there are other individuals with underlying conditions, particularly if they're older, and they might have conditions like diabetes or respiratory problems, etc., that makes them at a much greater risk of having a more serious adverse outcome from COVID. So essentially, what you need to do is, and most of this advice comes from the CDC, or the Center for Disease Control in the United States, and they've issued a very helpful document on this, is if you've got people who are really high risk within your family or within your household, then you'll have to behave as if all of you are potentially at a higher risk of transmitting the disorder, transmitting the disease. So what does that mean in practice? What that means in practice is if you've got somebody who's at high risk within your household, you need to be extra careful. So there are some simple practical things that you can do and some things that I do myself. So the first thing is ensure that you don't go out unless it's absolutely essential, and the government's guidance on that is pretty clear. But also if the government changes its guidance, the guidance changing doesn't mean COVID has gone away, it's still there. The levels of risk might be reduced, but they're still there. What you're trying to do is try to minimize the risk as far as possible. So the person who does go out for essential errands should be the person who is at the least risk, or the person with the fewest risk factors. Always wear a mask when you're going out. So particularly when you're going to shops and things. If you're going to touch stuff, make sure that you carry hand sanitizer. Have hand sanitizer at your the entrance to your house, so that when you come in, you can sanitize your hands. One of the things that I do, I work in a hospital. So as soon as I get home, before I go and hug my kids or say hello to anyone, I go upstairs, change my clothes, put my clothes for wash, and have a shower. Very simple, very quick, easy to do. It puts my mind at rest, and it reduces the risk of transmission. Ensure that you're ventilating your house properly. Particularly if you've got individuals in your household who are at higher risk, when you're socializing with them, try and maintain social distance as far as possible, but keep your rooms ventilated. I know it is really hard during winter to do this, but now that the weather's improving a little bit, or maybe not today, but in general it's improving, try and keep your windows open, ventilate your household as much as possible. Don't have visitors. And this is a really key thing about children. We know that children are less likely to have problems with COVID. They're not immune from it, but they're less likely to have it, but they can easily carry COVID. And they're more likely to be the ones who are going to hug your grandparents or hug their grandparents, and they can transmit it. So teach your children about the basics of good infection prevention practice. Get them to wash their hands frequently for the right amount of time, using soap. Get them to try and maintain a social distance where they can. Avoid them interacting outside the household where you have less control over the risk factors. And the other important thing, I guess, is to be alert to signs of illness. So pick up those signs quickly. If you're from a BAME background, you're already at a slightly greater risk. If you're older again, you have even more risk factors. And then again, if you have serious illnesses underlying that, you're at a greater risk of having a serious adverse outcome from COVID. So therefore, if you see signs of these problems, please do seek help. And I think that's a real nice segue to Sanjay, who can just talk a little bit about what to do if you start becoming unwell with COVID.
Thank you. The main thing I think I would say, and this is from personal experience from dealing with my own patients, is when you do develop any symptoms or anyone in your household develops symptoms, please don't ignore them. And you put in the measures immediately while you're waiting for the test results to come in. There's so many patients who ring me and they're waiting for either me to tell them to start following the rules, or they're waiting for a test result. That's not the case. Assume it's a positive until you hear otherwise. It's the best way to manage it. The main thing is, when you're living in a multi-generational household, is it can be often difficult to do a lot of the things you'd put into place. And I live in a multi-generational household. I've got young children. I have my mum with me as well. So we've got both ends of the spectrum. Everything that you've heard from Sanjay is absolutely right. You have to follow those things. I think when somebody falls ill, the main thing to start to focus on is to try and develop as much distance as possible from the person who is unwell. That doesn't mean you don't care for them, but you try and minimize the distance between other members. So certainly when we've had it in our house and, you know, someone's been ill, fortunately the test was negative, we try to keep the children away because, you know, they don't always follow the rules. Bless them, they're young, they will do what they think is right. So we made it a point that either myself or my wife, you know, would have contact. Wearing a mask when you're dealing, helping the person who's unwell, that's a big thing because that also minimizes the risk. If you're fortunate enough to have a spare room or somewhere where that person can be almost isolated, then please use it. And if not, you try and do as best you can to keep the distancing. When people are using a shared bathroom, it's a case of taking extra precautions, cleaning down surfaces, making sure that you're using a hand sanitizer or you're using, you know, washing your hands for the 20 seconds. I know everyone's heard it and we've been hearing it for a year, but it's one of the biggest things we can do and it has the most impact. I think the other thing is, and I would really say this, is keep a close eye on family members. And the biggest thing is do not be afraid to call for help if you're not sure. You know, you can always access medical care. We're so fortunate in this country. You pick up a phone and there'll be someone there. So if you're not sure, if you're worried, ask the questions. It's better to get the advice and then everything's fine than to let things get worse. Certainly as a GP, that's the first thing I tell my patients. If you're not sure, ring. It'll take us 5 minutes or less to either reassure you or tell you what you need to do next. And I think that's the biggest thing. Okay, thank you.
Oh, thank you.
That's really comprehensive from both of you. So many thanks for that. I'm going to go into another question that has, in fact, for the communities, has been actually a really important one around vaccinations. And we have really fortunate to have some of our faith leaders here today. So I'm going to ask them to answer this one. Does God want me to have the vaccination? Qatar Singh, can we go to you first?
Sure, thank you so much. I think this is a really important question for a lot of our faith communities that, you know, faith is an important part of many people's life. It's a source of inspiration, but it's also somewhere where, you know, when we're discerning some of the big challenging questions in life, we will go to seek guidance from the scripture, from our teachings, from our elders. And this is where I think this question comes up now. Could I answer that question and say, does God want us to have this vaccine? No. But I think there are things that we can discern from this. And as someone working within a community, working within a hospital, and being part and connected to a community, I think there are several questions that come into my mind. One is we have a responsibility to our communities to make sure that they are well protected. As a hospital chaplain, I've unfortunately seen the tragic way in which our communities have been impacted by COVID, from patients who have sadly passed away to having to support families who've lost loved ones. And each one of us knows people in our communities, you know, real gems of our community whose lives have been cut short by COVID. And personally, I don't want any unnecessary death. If someone's life can be protected, I think this for me is the beginning of my, you know, scriptural and spiritual understanding of this. Gurbani, the Sikh scriptures, the Sikh teachings, really encourages people to engage with the medical profession. It says that recognize that God has given us an intellect to learn and study and grow, and therefore we should use that and utilize that knowledge as best as we can for Sarbat Dapala, for the common good. And in this time of a pandemic, when we've had so many restrictions on life, when life has been challenging, when we've lost so many good people, and many people have suffered and struggled even now with long COVID and people becoming ill, it's important for us to take steps to seriously engage with what can we do that will protect our life, because life is a sacred gift. And many people of faith in hospitals have said to me, well, you know, life is in and death is in God's hands. Absolutely. But that doesn't mean we take a fatalistic approach to life. We take a responsibility. I sit in my car, I put on my seatbelt, I take steps to prevent, you know, infecting my family, making sure that they're protected by wearing a mask, infection control, having a shower, having come back from the hospital at work. These are all steps that we take. And this is what, from my perspective, from the Sikh faith, there's a real encouragement to say that we have a personal responsibility to take steps to protect our life, because a life cut short, who knows what great good that life could have done, how much love and care they would have brought into this world, what great innovations they have made to this world. But also, as an individual, I'm part of a community, and therefore I have a social responsibility. Many of our faith communities have struggled with the way that faith buildings, gurdwaras, churches, temples, and mosques have had to unfortunately close down or have restrictions in place. Many of our communities, particularly many of our elders, for them, this is a lifeline to them. This is a place where they find a source of inspiration, of comfort, of community, and many of them have been denied that access. I was talking with a researcher who was doing a bit of work for SAGE, and it was around the long-term impact on the social dynamics for BAME communities. And this was one of the great challenges that I said that we are going to see in the future. It's the long-term mental health impact of not being able to be in a community, to have those connections. And I think when we look at physical health, mental health, spiritual health and well-being is a core part of that. It's how a person sees themselves in their in the wider context of life and social encounter. And I think this is where we ask the right questions. I have a responsibility to my community, and that's where it's asking the tough and questions that we need to ask to our medical professionals, to those people who are in the profession who can answer those questions about the vaccine, about possible side effects, what are the way the trials have been done, so that we can have some surety that by taking this, we are protecting our communities, we're being responsible. And so this for me is the heart of scriptural and spiritual understanding from my faith community. And personally, I don't want to see another loved one of someone in this community to die from COVID. I don't want to know the trauma that families have been going through, especially during the early times when they couldn't even visit their loved ones in that very difficult times. But this is where we have that responsibility. And events like this is an opportunity for our communities to ask the medical profession those questions so that we can be assured that actually this is the best way we can reopen up our communities. We can restart the celebration of festivals and community and continue with our spiritual life, but also that personal responsibility we have to protect our loved ones in our communities, because people who will die from this, they're not some strangers, they are people who are part of our society and our world. And in Sikhi, we say the expression, Nanak Naam Chardi Kala Tere Pani Sarbata Pala. And that really says about standing and working for the common good of all humanity. And if this vaccine is one way in which we can protect and save lives, then it's a positive step forward. Thank you.
Thank you so much. I should have said Dr. Kartar Singh is the lead chaplain at St. Andrew's Healthcare. Thank you so much for that. That's exactly what I know we all need to hear. Pastor Donovan, who's the lead chaplain at you're a Afro-Caribbean faith leader. Sorry, Pastor Donovan. Would you like to go next?
Yes, good evening, everyone. Thank you so much. I'm conscious that time is slipping away, and what I would simply say is, I think my daughter looked at the question and said, does God want me to take the vaccine? And she simply said, why not? If our body is a temple, we have to really take care of it. I am conscious that there's a lot of trust that has been eroded with maybe the scientific community towards our community. But we're people of faith. I think Amelia's story sums it up for me. I just lost a good friend in London, came back on Thursday, recently married, but died through COVID. And I want to encourage the people of faith, those who have a trust in God. Yeah, I think it's not to ask God, should I have the vaccine? Is, am I a good neighbor? And we are to love our neighbor as we love ourselves. We will never know for sure if everything is perfect. And I really think history has taught us that, from time to time, these things come upon us as a world, and good people have got to come together. I would hope that people with whatever agendas would not make it so bad for people to make a right decision. We are people of faith. We have got to trust what our doctor says. Things are not perfect, but one of the things, even though I may be speaking from the position of faith, I'm also looking at the economy, and people want to get back to their holidays. People want to see their loved ones. And personally, when I would have thought that, okay, this vaccine has come up on us too quick, and I'm glad that our doctors informed us of the process. And sometimes we've just got to trust those who are probably telling us what is right, and just accept it. I've had mine. I've prayed, and maybe a lot of people are questioning, and why should I take it? Is it right for us? We're the ones suffering, and I'm so grateful to have heard Eva Miller's story. So I would encourage everyone to step back a bit and let us not be so drawn in all this information that is so overloading us. Make a decision and trust the process. And we will continue to pray because I'd really love to see the economy open up. People go about enjoying themselves, as it were. And let's rephrase the question. Instead of asking, does God want me to take the vaccine? We probably should say that God wants us to be good neighbors for each other. Thank you very much.
Thank you, Master Donovan. Yeah, I think that does sum it up in terms of, am I a good neighbor? I think that says a lot. I'll bring in Krishna Takrar, who is a faith leader within the Hindu community in Wellington mainly.
Good evening, everybody. The question is, does God want me to have the vaccination? So the short answer is, since the pandemic started, I haven't met this chap called God to ask him whether I should have the vaccine or not. But let's look at it from a rational point of view. From a Hindu perspective, all life is special, all life is sacred. And hence, it is every one of our duty to actually reduce any suffering that goes on with any kind, not just the pandemic, but any kind of suffering. It is our job to reduce that. So from a faith perspective, from a Hindu perspective, reduction of suffering is the key. So does God want us to have this vaccination? Based on rationality, I would say yes. Because if God didn't want us to have this vaccination, then God wouldn't have given the brains to all the scientists who have actually come up with this vaccination in such a short period of time. God has actually encouraged the production of this vaccine, hence we should have it. So why should we have it? To protect ourselves, to protect our families, to protect our neighbors, to protect society at large. So let us all be good citizens, have the vaccination. I know there's a lot of sort of fake news, I'd call it, about different things and different side effects and all that. Let's get one thing clear. Life has its own side effects. The moment we are born, we've got the positives and negatives of life. Whenever you go to a doctor, any tablet or any medication we are prescribed has its own side effects. This is no different. Most people will tell you, yes, they've had side effects, they're short-lived, and they do all recover. So based on that, I think rationality tells us life is special, life is sacred. Let's reduce our suffering for everybody. Let's have the vaccination. Thank you.
Thank you so much, Krishna Bhai. That's great. And it's good to have faith leaders kind of confirm some of the medical kind of observations and comments as well. I'm very conscious of time, but we've got some really key questions. So I am going to go over time if that's okay, but please try and stay on if you can. What we are trying to do is, if we are recording this session, we will make the link available, and also that there's an information community pack that people can have after the event. And we'll try and get all the other questions we might not cover today answered at some point as well. So I'll go into the next question, but if I can ask just people answering to be as brief as possible, I'd like to get through as many we can. This is a question on shielding. And I'm going to ask Dr. Adeji, who's the GP registrar at Northampton General and a BAME clinical fellow, to answer this one. The new shielding arrangements, why has the government introduced new shielding arrangements and what are the implications? If you can be as brief as possible, please.
Okay, good evening, everyone. So the new shielding implications at the minute, because we're studying the disease on a daily basis. So what has now happened is a predictive risk model has been put together by researchers and scientists at Oxford University. So it's called the Q-COVID calculator. And this calculator now takes into account things like your age, your ethnicity, your BMI, which is your body mass index, your sex, your postcode, and health conditions as well. And the way they've developed this model is going back to the data of people that have sadly passed away and also been hospitalized. They've been able to work out that, okay, more people need to be considered at being at higher risk of contracting COVID. People with clinical conditions that need to be considered as well would include things like severe respiratory conditions. So if you've got severe asthma, severe COPD, if you've got cystic fibrosis, those are conditions that are on that list. People with cancers or immunosuppressive therapies as well, they're on that list. Things like patients that have got Down syndrome, adults with Down syndrome are on that list. People that have got issues with problems with their spleen as well. So if you've had your spleen removed, you're on that list. And then two more categories that really come up for me would be people that are on dialysis and also having they've got end-stage renal kidney disease. They're on that list. And finally, women that are pregnant with heart disease, they are on this new list as well. So any significant heart disease, either from birth or they've just acquired it, they're on this list. So speak to your GPs. This will be in place till the 31st of March. So yeah, and we'll review things as time goes along. That's the shortest version.
Thank you so much. That's a lot covered in that question. I'll take another one, which I'll ask Dr. Mutambeki to take. With regard to COVID, what early intervention and treatment were given? Dr. Mutambeki, are you still there?
Yeah, I'm here. I'm here. So I would want to defer this one to Sanjay as a GP in terms of the treatment of of COVID.
Sure.
What we do know is that there are a few clinical trials that have been going on. One recently published in the Lancet, looking at the various medicinal products that have been used in COVID. One of them is an antiviral called Remdesivir, and there's been a lot of talk about things like hydrochloroquine, etc., etc. I must say, from those clinical trials, some of the evidence is quite weak in terms of, how those medicinal products are changing the disease once it's taken hold. So it's no more different, no more significantly different, than the natural disease process. So my advice to everyone is really that let's look at, not ending up in that situation. Let's look at, prevention as being, the most important way of, surviving in this pandemic. Prevention, I'm talking here about, some of the infection prevention and control measures that, previous speakers have spoken about. Sanjay spoke about, intergenerational households, as did Sanjit. And I think those, those simple measures of, preventing the spread are the main thing. Assuming that you're positive, if you start to develop symptoms and, isolating yourself, that's a positive. And actually looking at getting yourself the best chance of fighting the infection before you even come into contact with it, and that's being vaccinated. So by far, one of the most effective and the strongest pieces of evidence about survival, prevention of hospitalization in this pandemic has been the vaccine itself. Once the infection has taken hold, the evidence suggests that some of the medicinal products are not making a significant impact in modifying the natural history of the disease.
Dr. Gadia, if I can ask you to respond as well to that, but also if you can take the next question as well, which says, if you've had the vaccine, can you still catch the virus?
Okay, so I'll try and keep this short. So in answer to the question, the treatments are very limited. It's like I said, there's a few treatments out there, and a lot of them are being tested. But your best treatment for this disease is your body's own immune system, and the only way the immune system tackles it is with the vaccine. So there you go. That's the treatment there. And I will say this to everyone that I see. In terms of can you still catch the disease if you've had the vaccine? In short, yes, you can. You can get the disease if you've had the vaccine. However, and this is the big one, if you've had the vaccine, your chance of serious complications massively reduces. So this is the part about if you've had the vaccine, your biggest risk with COVID is some people get it and they say it's nothing besides a cough, cold, a bit of flu. That's wonderful for them. The ones we are concerned about is the ones that end up needing intervention in ITU, in hospitals. The worry there is that they have serious complications, and we know the vaccine massively reduces your chance of this. So if nothing else, if you have the vaccine, it will stop you from having the serious consequences of COVID, and that's the bottom line with this one. Thank you.
Okay, it might be that you still continue with the next two, but I'm happy if anybody else wants to respond as well. So with the new mutations, would we have a vaccine every year like the flu vaccine? And a related one, somebody's worried about the new variants, and how confident are we that the current vaccine strength will protect us against the new variants as well?
Okay, so will we need a vaccine going forward? At the moment, we don't know, but the science is moving forward, and it's probably suggesting that yes, we will need boosters. When and how often is still to be determined. But if we take another example, so every year we go for a flu jab. A flu jab is a virus. Viruses are very clever. They learn to change. Fortunately, the scientists who've been blessed with all the expertise in this are just as clever. So they are working out ways to tackle this. So the odds are that we will need to have boosters, but we don't know the timings or the frequencies of that as yet. In terms of the variants, there are different variants coming out, and I think every week you turn on the news and there's something else that's come out. The evidence so far is showing that the vaccine does provide some protection against these. And again, we have to look at the serious complications part. The vaccines are preventing serious complications with these variants, but as new variants come out, each of them is being tested. And again, in this country, we are really fortunate that some of the experts worldwide are based here at quickly looking at these variants and working out what they're doing and how effective the vaccine is going to be. So at the moment, please still go for the vaccine. Do not wait for a new vaccine or anything, because you are still being protected. And I'd say that's the main message.
Great, thank you for that. Another one, I'll fully ask Dr. Kamnath to take this one. We know that the BAME communities are at high risk of contracting COVID, and if they don't get the injection, that they're at high risk of death, especially with those who have comorbidities. Why has this group not been prioritized for the vaccination?
It's a really good question. So being from a BAME background is just one of many risk factors. There are many more significant risk factors. The biggest one is age. The other risk factors are having comorbid physical healthcare problems, So if you're in the older group, and you'll have seen from the slides earlier that the target population in the first wave of vaccinations was those above the age of 80, and then healthcare workers, and then they've moved the tiers down according to the age as well. So that's the reason why those who are most vulnerable were the ones who were prioritized first. So that's the reason for that.
Great. Another question, again, don't mind who takes this. Why do we think Corby has the highest rate of COVID cases rates in the country? Dr. Sanjay? Gadia?
I can try and answer this one. To be honest, we don't know why Corby's highest. It seems to change. A lot of it is all determined by how closely people follow the advice that's out there. It's about how about migration of people when they're coming into work and moving, and we know that Corby has a lot of industry in there, a lot of factories that people travel into and out of. It's a difficult one. All we can say is that it just shows that despite best efforts, this virus is clever, it will spread. So you just have to keep doing everything that you're advised, and we can't let our guard down. That's the biggest thing. We cannot suddenly drop our defenses on this one. But hopefully the message is getting out to the population of Corby, and we should see the rates drop very soon.
Okay, great, thank you. And another related one may still be for you, Dr. Gadia. We haven't heard this in many cases, but Satish Shah is asking that he's had his vaccination, the AstraZeneca, on the 21st of February. He was fine for 2 days, and then he had a health issue following it. Can you explain that?
Okay.
He doesn't describe what the health issue was. Sorry.
No, and I don't want him to go into it on such a public forum. However, we do know there are some recognized side effects, and some people are very fortunate. They have no side effects. Some people can get side effects for a few days. The biggest thing I would recommend, and I'm dealing with patients with this at the moment, please don't presume that all health conditions are suddenly due to a vaccine. It could be something happening and it's just completely coincidental. So my advice is please contact your GP, explain this, and they will investigate in isolation, as well as if they feel if it is due to the vaccine, they can report it, and also contact the experts who work for the pharmaceutical companies who can provide more advice. But please don't presume it's always a side effect from the vaccine. We can all fall ill at any time, and it's unfortunately sometimes it's coincidence that things happen around the same time.
And just to add on to that, really, so when it comes to taking the vaccine, some people feel if they've got COVID already, there's no need to take the vaccine. Please, please, please go and take the vaccine. Yes, your body would have developed so that natural immune response, but right now we don't know how long that lasts for. So taking the vaccine ensures you're actually protected, and then we can investigate things further.
Excellent. Thank you so much for those really comprehensive answers. And we were really keen that people got the opportunity to actually talk to you directly as medical professionals and faith leaders. So thank you for that. We are going to stop the questions there. I think we've taken the majority of them. I'd just like to take the last poll based on what we heard earlier. And if you can just complete this, please, we'll give you a few minutes. So there's just 2 questions, and if you can try and all complete them, please. Okay, everybody's still voting, so please answer. Okay, so excellent. I think 74%, all the presenters, a big thank you. And you've obviously kind of answered everybody's questions really well. Obviously, there's still concerns, and we appreciate that. And like I said, we're hoping to have other sessions. Brilliant to see that most people are likely to have the vaccination. Inevitably, there are people who may still be concerned. So thank you for that. That gives us a really good measure of today. Thank you. What we've done as part of the kind of the team who were planning this, we were very mindful that we want to give as much information as possible to local people. So what you can do now is, if you're able to on your iPhone or phones, you can actually take a scan of that image, just there Nick is indicating, but also we'll put an information pack on those sites that you see there as well. And that information pack will have hopefully a lot of the information you've heard today. And if we can ask you all to pass this on as widely as possible amongst your family, friends, neighbors, and communities, that would be excellent. Is that okay? Just give you a couple more minutes just to scan that if you haven't done so already. And the pack is really good. We'll try and pick up some of the questions we may not have answered as well. Okay. Thanks, Nikki. I'm just going to... Okay. I just want to thank all the presenters, speakers, everybody giving up their time today for, I think, has been an excellent, event. We've covered a lot of ground, the long COVID, the personal story, the kind of the background to the vaccination. And I hope that that's given many of us a lot more reassurance, not only in the vaccination, which was kind of obviously key to us and Black communities, but also I'm personally very grateful to have met a lot of our kind of Black professionals who are working in the health services and have made such a huge contribution, and the faith leaders who continue to do their work, which is critical. So I feel really privileged to have met you over the last few days, and thank you for doing what you do in the health service. As I said, this was a dedication to everybody who has suffered any loss and bereavement over the last few, the whole year. I certainly have in our family as well. And so in dedication to them, thank you for your support today, and to everyone. Have a really good rest of the evening and weekend. Thank you.
Thank you, Fatima.
Oh, sorry, I should have said, we have got some videos from community members, which if anybody wants to stay on, please do, and we can watch that. But if people need to leave, we'll completely understand that as well. Thank you. Nikki will play the community videos. Thanks, Nikki.
I am the Chief Officer of Central and East Northamptonshire Citizens Advice. I will be taking the coronavirus vaccine because I trust the vaccine more than I trust coronavirus. Coronavirus has been shown to have a much worse effect on Black communities than other communities. The vaccine has not been shown to have a worse effect on Black communities. I was doubtful about the vaccine initially because of how quickly it was developed. So I did some research. I looked at the British Medical Association website. I looked at the NHS England website. I spoke to anyone I knew that was working in the medical profession. I didn't trust social media, and I didn't trust the opinions of people who are not medics. My research showed me that one of the reasons that the vaccine was able to be developed so quickly, for example, was because whereas it might take months to find hundreds of volunteers to be tested on, hundreds of thousands of volunteers came forward in a matter of weeks. I think 100,000 volunteers came forward in 4 weeks to test the vaccine on. So for that reason, the clinical trials were able to be done much quicker. They were still done safer, they were still done to the same levels that would normally be expected, but it was just able to be done much faster than normal because more people were made themselves available to be tested. The marketing of a drug normally takes months, but because so many countries, medical teams and so on were looking for the vaccine, the marketing didn't need months. So for those reasons, the vaccine was able to be developed much faster than normal, but to the same clinical standards that would normally be required. I am a black woman from a black community. I'm in my 50s. I've got a young child. The impact of having coronavirus on me would be possibly a lot worse than it would be on other people. I want to be around for as long as possible and I want to be as healthy as possible. So for that reason, I will take the vaccine. The vaccine will also not just protect me, it will protect other people who I might otherwise have passed coronavirus onto. So I'm not just protecting myself when I take the vaccine, I'm protecting my child, my family, my friends, and my community. So for that reason, I will also be taking the vaccine as soon as it becomes available to me.
Good afternoon. My name is Pastor Donovan Allen. I'm the senior pastor for the New Testament Church of God in Northampton. I would like to address this issue of should we be vaccinated. First, I was somewhat skeptical about the quick release of this new vaccine. But on reflection, I believe all of us should really applaud the scientific community for the tremendous work they have done to ensure that we get to this place, although we know things are not perfect. Secondly, I'm inclined to believe that every member of our community should give serious consideration in taking this vaccine, because statistically our communities are the one that is at greater risk. A third point I would want to add is that I think we should press the pause button and consider ourselves to be that if we are good neighbors, then we should really give serious consideration in taking this vaccine, because taking the vaccination is not protecting ourselves, but we are protecting others. I would also like to interject to say that many of us have prayed, and we have prayed and asked God for an answer. And if this is an answer, which I think it is, why do we continue praying when God has given us the answer? But again, that's debatable. I also would want to put a word caveat and give a word of caution here to say that I think we should be very careful where we are getting our information from. You and I have a responsibility that we make sure that we don't spread misinformation about this vaccine, and when we don't have the technical know-how. And we also got to be very careful that, we base our decision based upon reliable and credible information. So I would want to encourage my community, our community, to really press a pause button, think carefully, pray about it if you're someone of faith, and let us do what is right, not only for ourselves, but for our community. Thank you.
Hi everybody, my name is Mavis and I got vaccinated early February. The reason why I got vaccinated is to boost my immune system so that if I do get an attack, the symptoms will be mild. Thank you very much everyone. Have a good day, bye.
Hi, my name's Tim Brown, Head of Equality, Diversity and Inclusion. I just want to encourage as many people as possible to take the vaccine when offered. If you wanted to access more credible information, by all means speak to your health professionals, access NHS England websites or the hospital website, NGH, KGH, NHFT, or go onto local government websites. There's a lot of credible information out there that suggests that the vaccine is safe. Bye.
Hello everyone, my name is Aaron Mandalia and I'm 57 years of age. I've had the vaccine, I've had the first dose of the vaccine because I wanted to protect myself, my loved ones and others. I would encourage everyone to take the vaccine because it's just so important to save lives. I've had the vaccine in late December of last year, and just for a few days after the injection, my arm felt a bit sore and heavy, but that was all. Now, this is my mother. She's 85 years of age, and she's had both the vaccines, both the doses, and she's had no side effects at all, apart from just a general arm heaviness, that's all. So I would encourage everyone to take the vaccine. Thank you.
Mark Dean here from Inspiration FM. I think it's very important that we look after ourselves, protect ourselves and our families by having the vaccine. Many members of my family have had the vaccine and I'm on the list to be done too. So stay safe, stay blessed, look out for one another, and the sooner we can get this vaccine, then the sooner we can get back to some sort of normality. Thank you.
Go. And I'm 87-year-old. Will be 88 this year sometime. I wasn't hesitant about having it because my husband is in a care home and I'm concerned more of not being able to go to see him. But if I had the vaccine and he had the vaccine, I'll be able to see him when possible. I think everyone should take it because I haven't had any reaction or any bad reaction. Slight headache for the first couple of days. But I felt as if something different. It was more helpful to me than just taking painkillers. Yeah, I think each person should try and take it.
When did you have your vaccine?
And on the 16th of January, and I think it was a Saturday afternoon, my daughter took me. Yeah, I felt all right. The Saturday, the Sunday, Monday, I think it was the Wednesday, then my arm felt a bit heavy. But from then, nothing. And I haven't feel sick. I didn't want to eat much. I was scared of maybe just doing it, but not for any special reason.
Okay. Hi, I'm Carol Werner, Head of Equality, Diversity and Inclusion at Kettering General Hospital. When the vaccine came, I was not so sure it was the right thing for me to have the vaccine because I had a lot of questions that I needed answering. When I got those questions answered, I had my vaccine. So I've had my vaccine. Think about it. Join in this and have your vaccine.
Hello, my name is Jagruti. I haven't had my vaccination yet, but I'm looking forward to receiving it. It will give me protection and also give protection to my family. But more importantly, I see it's the right thing to do to protect also the wider society. Thank you.
Good evening. My name is Pauline Woodhouse and I manage a local community centre in Northamptonshire. I'm also the co-chair of Northampton Women's Forum and Northampton Diverse Communities Forum. I understand that there are issues and concerns from BAME community members around the COVID-19 vaccine, and I support this event, the Northamptonshire Black Communities Together and Social Health and Care Partners. This event will support local people in terms of giving them the opportunity to raise any questions or concerns that they may have around the COVID-19 vaccine. Please use this opportunity to ask any questions, raise any concerns in order to make informed decisions around the COVID-19 vaccine. Thank you for your time. Enjoy the event. Take care.
Good afternoon. My name is Krishna Thakkar of the Wellingborough Hindu Association. I have not had my COVID jab yet, but I'm very eagerly awaiting my call so I can go and get it in a snap. Everybody should have a COVID jab because it keeps yourself safe, keeps all of society safe. And on a selfish note, the sooner everybody gets the jab, the sooner I can go and have my hair cut. So thank you, stay safe, stay well, and get vaccinated.
Thank you for those who stayed behind, and we'll try and get as many of those published as possible. They were great contributions. So again, many thanks for your time, and to all the presenters. I want to thank the organizing team who've been fantastic in putting in this whole event together. Sorry, hope to see you all soon. Thank you very much.
Thank you, Pratima. Good night,
Bye.
all.
Bye.